So you really need to get in the office, sit with your medical assistant, sit with your front desk staff. How are they executing that process that you created, a year ago? Are they still doing that? And find all of the gaps.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Kelly Poole. Kelly is the VP of Operational Excellence at a large healthcare company and the founder of The Improvement Space, a consulting business specializing in process improvement and operational excellence. Welcome, Kelly. Thank you for joining me.
Thank you for having me, Janelle. I'm really excited about our conversation today.
Yes, me too. I just want to kind of hear what your background is. You're a nurse by trade, correct?
That's right. Yeah, I've been in healthcare for over 20 years. I started as a nurse in the hospital system. So I have experience on both sides of healthcare. I'm on the corporate side of healthcare now, but that background that I have, I think has helped me really understand when the business side needs to implement a change. How do we really do that so the clinical side understands the change and can actually implement what we're asking them to do?
Yeah, it's good to have both sides of the picture so right. You can really understand where the needs are and how you can really help to meet those needs too.
Right.
So tell me, how did you move into the dermatology space?
So, 10 years ago, I was working in New York City and I was ready for a change. And I had a friend introduce me to a CEO of a dermatology company. And I thought to myself, I don't have experience in dermatology. I am cardiology. That's where I've always worked. So this is not going to work out. But the company I was interviewing for actually was the first to kind of point out to me that my skills were transferable. So I had put myself in this category of I know cardiology, but really what I knew was healthcare and healthcare process. Mm-hmm. So I started working for a dermatology group, and realized very quickly that I thought I was going to be behind by not having that dermatology experience. And I would say, very quickly I realized healthcare is healthcare.
Yeah.
And now I've been with that company for 9 years.
How does your healthcare experience shape your consulting approach?
So my experience in healthcare has been solving problems and solving problems with process. So let's back up. What is process? Process is anything from as small as how do you collect money at your storefront to as big as how do you open a brand new medical practice. And you really need to document the steps in your process. And once you have that documented, sky's the limit on how quickly you can grow. So you need your teams to understand what it is you need them to do. They need an easy way to do it. And then you need a way to track to make sure that that's happening. So that's process. And then how do you solve problems with process? So this is where I think my healthcare background helps with solving some of these problems is identify what your problem is. Using data, what is your problem? And then assign someone to understand what that problem is. Oftentimes, someone is looking at data and they know this number is low. We need to fix that. They're not the same person who understands why the number is low. And that's not the same person who understands how to fix the problem. Mm-hmm. I feel like I've been able to sort of mesh all of those together into one, but I understand how to communicate with the people that don't understand the other part. So identifying the problem, number one, assigning somebody to solve the problem, number two. And if you don't have that person internally, don't be afraid to look externally. There are a lot of people out there, in which this is what sort of drove me to professionalize my consulting, is there are a lot of people who reach out to me and say, I've got this problem. How did you solve it? And I think that's wonderful. You don't have to always go from within. Then once you identify the problem, there's this Einstein quote that I love. I say this all the time, but Einstein said if he had 1 hour to solve a problem, he would spend 55 minutes thinking about the problem and 5 minutes thinking about the solution. And I think that is such a great framework for problem solving because often we'll misdiagnose the problem. We'll think the problem is here, not realizing the problem is 7 steps upstream, and you can't figure out why you're not able to solve your problem. So performing an audit of your processes, and not an audit of your documented processes, an audit of your real life processes, because that's what's happening in your offices. And the bigger you get, the further away you are from what's happening in real life. So you really need to get in the office, sit with your medical assistant, sit with your front desk staff. How are they executing that process that you created, a year ago? Are they still doing that? And find all of the gaps. So let's give an example that we have a problem in RCM. Claims are getting denied because the provider wasn't credentialed with that insurance. So how do we start to identify the problem here? And it really could go as far back to as when that patient was scheduled, were they registered properly? I had Blue Cross last year. I have Aetna this year. It still says Blue Cross. Of course, my claim's going to be denied. I don't have that insurance anymore. But have you identified all the steps in the process that could lead to an insurance not getting updated? So that audit of real life is really, really helpful. Bringing all of the teams together to understand the scheduling piece, the check-in piece, RCM side, bring all of those experts together. So because there's no way one person can understand the nuances of all of those individual departments, bring everybody to the table to sort of map out what you want to happen. And then you've maybe solved your problem on paper. The hard part really starts when you need to execute that. Now we know what we need to do. How do we get the people to do it? That's kind of my superpower, is understanding. Now I know what this team wants. How do I get this team to do it? And I feel like I've simplified it a bit. It's like, oh, light bulb. Yeah, okay, that works. Setting the standard. That's what we just did with all of those different departments, right? This is how we need this process to work. Document that standard. So many people I see miss this piece, documenting what we actually want people to do, and then train people to that documentation. And you're training the people that are in your company now, but don't forget about the people who are joining your company tomorrow. How are they going to get this information? And what I've seen so often is we train the people we have now, but we haven't thought about the new people. And then what you create is this institutional knowledge problem. Institutional knowledge is great, but if that person who has all the institutional knowledge leaves and you don't have that process documented, right? So
they take it with them.
It creates a huge gap. And we've all been in places where we learn how to do something and you say, how do you know how to do that? Oh, that's just how we always do it. But there's no way for the new person to learn that, So training is so critical, training both of those people. Another piece I think we often forget, if you nail the documentation and you nail the training, another piece people often forget is creating the accountability and the sustainability of that change. Because change is hard. And oftentimes somebody will do something the new way while you're looking. And then when you're not looking, nature takes over. And we go back to the way we know how to do something the easy way. Not that anyone's trying to skirt work or not change, but people in healthcare are busy. And if it's easier to do it the old way than it is the new way, people are going to revert. So creating that accountability and visibility. So do you have a metric that you can measure on a weekly or a monthly basis that will tell you, are people doing things the new way? And that ties back to the very first step of this process of, we have a problem because this number is too high or this number is too low. You have to track it all the way through. So that might be a really long-winded way of answering your question. No, but that's sort of how I see from VP has an issue all the way down to the front desk staff doing something differently.
It makes so much sense too, because so many offices, they're probably missing that. Do you find that is like one of the biggest things that offices are really missing, is just that understanding of, it's not just one person that can do everything in the office and expect things to work better. Absolutely.
And it's not anyone's fault, but that's just sort of how we're wired. We're in our silo. We're in our lane. I know that this is the thing, right? There's no way for somebody at the front desk to know what's happening in the billing department unless you've created that visibility for them, which is also really important when you tell someone they have to change the way they do something, is telling them the why, showing them a patient journey of scheduling, registration, check-in. Did we get all the things right? Do we have their email address so we can add them to the portal? Do we have the right insurance so the claim doesn't get denied? Do we have the right, whatever other piece of information is needed down the line? And letting them know why it's important. Some companies really struggle with getting front desk staff to do a thing because they have so many things they have to do, and they have a line of patients that are waiting to check in. If it's not a required field or it hasn't been like ingrained in them why it's important, they're going to skip it.
Yeah.
And that's not just front desk. I feel like I'm picking on front desk a little bit, but that's everywhere,
I feel like when offices get started, they're ready to just get going, get patients in so they can kind of get in the groove of things. And a lot of times those little things get missed as far as the processes. And when you try to go and change that process, it's very, very difficult to implement that process with everybody, to get everybody on board. So what are some things that you're seeing that have really helped to kind of transition and get people, to kind of buy in, really, almost?
Right. I think it starts at the top. It starts with your company culture and having a culture of standardization. Everyone knows how to do their job because you've standardized it, you've documented it, you've trained on it. Everyone knows what to do. And then when you need to change something later, it's so much easier if everybody's on level A and we're now taking them to level B. But if you didn't standardize initially and you've got 20 different ways to do a thing, now you're taking 20 different ways and changing it to a new way versus everyone was doing it like this and now we're going to do it like this. Your learning curve is 20x now because you had 20 different ways to do a thing. So from the beginning, when you're starting a new practice or let's say a new manager is coming in, from the beginning, standardize. Standardize everything across the board. Be very black and white about it. And then you can create your one-offs. There's always going to be one-offs. So create your one-offs after you've sort of made your culture or standardized. Think about flying a Southwest flight. It doesn't matter where you start your flight and where you end your flight. It is the exact same experience. And imagine if it were different at every single airport. As a customer, it would be very confusing. Do I line up in section A or do I wait for you to call my group? You know what I mean? Like, I know if I fly Southwest, I know what that process is. And you want your employees to have that same mindset. I know when I show up at work, this is what I do versus this is what I do if it's this is what if I do, there's no real way to do it. So I just do it however, and I might get in trouble later. I might never get in trouble for this. And that's a a stressful situation for your employee. I also like to think of process as being very kind to your staff. So they can come in with really clear expectations. They know what they need to do. They know how to do it. And they know they're going to be held accountable. We all like that. We all like boundaries.
Yeah, definitely. I think a lot of times too, when you have a staff that's been established for a while, and then you have some turnover, and that's where things can get a little bit kind of weird because then you get the staff that's coming in, that's training and trying to learn the process. But then you have some of the staff that may not be fully on board with that process because they think it could be done better. So then that kind of messes up that work culture and just adds so much to it. There's so many different variables that go into it, but the key is definitely the management, I would think.
The management. And then if you think about the management as your customer, so if you're the process improvement person and the management is your customer, how do you support the management so they can hold the staff accountable? So the management needs to know what the process is so they know if someone's following it or not. But you have to give them visibility into the work. So data is so important. And it can be big data systems like Power BI, or you can create your own tracking mechanism in Excel. And you can look at whatever the metric is you're measuring. You changed a process because let's pretend you had to change a process. Simple. You had to change a process to make sure you get every patient's email address. Well, short of the manager standing over the front desk staff to make sure you have an email address for every patient, there's no way for them to know if it's working or not. So providing your managers with data so they can do their job and let them know that if this number is X, here's the action you should take. If the number is Y, here's the action you should take. So again, having that process to support them so they can come in and do their job. And a saying I like when I'm solving a problem is let's not solve the same problem twice. If we've identified it as a problem, let's set a standard, Let's train everyone on that standard. And then we don't have to think about that thing again because we've already established what the answer is. And it frees everybody up to do more.
Right. So what if when a manager is coming in, I mean, you can't possibly work every single role. I know, and ideally it would be great to know every single role that you're kind of overseeing and that you're managing. But what happens when you don't quite understand that role and not necessarily sure on how to fix it? I think, that's where you kind of have to have some trust in your staff to give that feedback, I would guess.
Yeah, the feedback loop's really important. I'll tell you a story of a workflow audit I was doing once. And the problem we were trying to solve was the front desk may be overstaffed. We think there's just a lot of people doing that work. And so let's do an audit. Let's see what they're doing. And what I found was there was a considerable amount of time being spent filling out an Excel document. This was years and years ago, before a lot of the fancy reporting. They were filling out this Excel document for every payment they collected. The patient, the MRN, the date, the amount, the method, check, cash, credit card, whatever. And I thought, I know that, we're actually collecting it in the system. So I feel like this is double documentation. So instead of just thinking this is what they do, I started asking a lot of questions. Why? Why are you doing this? How long have you been doing this? Is this information captured somewhere else? What do you do with this Excel spreadsheet once you're done? I send it to finance. Okay. So I then, my job that day, I was told audit the front desk staff, but I needed to then go to finance. I needed to follow that piece of paper. Where's it going? So I asked someone in the finance department of this company, what do you do with the Excel document that you get from each office at the end of the day? I have no idea why they send that. We don't use it. We delete it. Somebody might need it, but we don't. So that person never spoke up. They never spoke up to say, hey, we don't need this anymore. So unless someone else needs it, let's stop doing it. I went back to the front desk. I said, you don't have to do the Excel anymore. It was the best day that they'd had in a while because it was such a cumbersome task. And we just stopped it overnight and never heard another thing. We didn't need it anymore. I think it served a really good purpose at one point in time. And then as our technology evolved, we didn't need that anymore, but nobody stopped that process. So understand, like creating that feedback loop and empowering people to ask questions, challenge the assumption. What's the saying? The most dangerous words are, that's how we've always done it. Right?
Yeah.
Because you don't understand why you're doing it, but that's just how we've always done it. So we'll just keep doing it that way. Empowering your staff to challenge assumptions and ask questions, ask why 5 times until you get to the real why. And you will find all of these like non-value add tasks are buried into work. And that's what we discovered when we thought of this company, is the front desk overstaffed? Well, according to the work they were doing in that time, no. But once we redesigned the workflow, we were able to right-size staff and then use those additional resources to do other important things. Nobody had to fill out an Excel document that only got deleted at the end of the day.
Wow. That makes so much sense.
In your work, it's so important to make sure that everyone's focused on the right thing, right? Because you need the specific documentation in order to get prior authorizations for biologics. And if somebody's not aware of exactly what they need to document, the rework that's created, because you have to go back and maybe you have to addend the note and you have to say they haven't improved on therapy X, so it's now time to move to therapy Y.
And I still have not been able to figure out why it's so difficult to help offices understand that it's more than just the prior authorization. That, when you're working to get a patient started on a medication that is time consuming, that, it takes a while. You've got to go through so many different step requirements, therapies, processes. And then on the other hand, you're still having to educate the patient to make sure that they are fully aware of what they're starting. So, that time that the patient has in the office is very short. So they're not getting, they're getting the information, but they're forgetting majority of that information that we've given them. So, helping the office to understand that it's the whole office kind of plays a role in that experience of the patient. whether or not they're going to come back for that follow-up appointment based on that visit that they came in for. And if they're even able to get the medication that they were prescribed, they were told that, oh, this is going to work great for you and it's going to clear your psoriasis or your eczema. And so now the patients got hope and thinking, okay, I'm going to get this medication and it's going to work great because that's what my doctor said. But then they leave, and then weeks later, they still can't get this medication. And then they've got to call and figure out, where's my medication? I was in the office months ago and I still haven't gotten anything. So where that disconnect is, I see a lot is the process, the workflow, and understanding, okay, maybe it was they didn't get the insurance card at the front desk, or they didn't get the pharmacy benefit card. And then, there was lack of communication with the follow-up as far as who was handling that prior authorization, who was communicating with the patient on the status of that prior authorization. Because if that prior authorization was denied, why was it denied? Was it denied because there was missing information in that chart note? So there was a miscommunication there where the documentation was missing. So there's so many different moving parts that I see that, it's just, okay, if we could all kind of be on the same page and kind of get it standardized to where everybody understands the importance of their role in that process in maintaining that patient and keeping that patient to coming back and being happy and excited about their follow-up appointment and knowing that, okay, I'm going to be taken care of. I had a patient I had interviewed a while ago, and we were talking, and she was telling me that she had gone to multiple different doctors and to try to treat her psoriasis. And the reason why she didn't stay with those doctors is because they didn't explain things to her. She didn't feel like she was being heard. So they weren't really talking to her and going over the process of, what they were prescribing and how they were treating her. And the staff just wasn't very helpful as well, until she finally found an office that was able to sit down with her, go over things and explain to her. And she felt confident in that decision because it's kind of a buy-in, it's a two-part thing. And she felt like the staff really helped her and followed up with her and showed her, this is how long it's going to take. This is what you should expect, at least setting those expectations with the patient so that she knew. And that is so difficult to find and within the process, that's one of my biggest frustrations.
That sounds like a really great experience that she ended with, she found the right person for her, the right provider for her. But it's really tough to offer that level of service in healthcare today when you're on this, you've got a 10-minute appointment slot, you've got the administrative burden, you have a 10-minute visit, and then you have 20 minutes of administrative work to do for that visit, right? Whether it's the documentation or a prior auth or sending the prescription or scheduling, like all of the work that happens, there's so many steps. And going back to, you were talking about the various things that need to happen in order for this patient to get their biologic. It could be 30 things have to happen. And that's just for the biologics type patient. So again, if we go back to our customer thinking of it as the medical assistant, so this is what I have to do for biologics patients. This is what I have to do for cancer patients. This is what I have to do for whatever. It's impossible for any person to remember all the steps. And that's where simple tools like checklists. This is our biologic patient checklist. And then not only is it a list of tasks that need to happen, but you have to assign the ownership because the medical assistant might only own 20% of that list because somebody else is doing the other piece. Somebody else is filling out the form for the prior auth, for the insurance company. But there has to be accountability that this is what has to happen. This is who's supposed to do it. And then who's looking at that list to make sure everyone's doing the thing that they need to do. Because just hoping by chance that everybody remembers I'm sure you know this better than I do, but that is not going to happen. And there's a book called The Checklist Manifesto that is about that. And I believe in that book, they tell the story about a hospital that needed to reduce infection rates for surgery. And it came down to a checklist of do these things. And that's so simple, a checklist. It's so simple. We have it hanging on our fridge for, what I need to do today, right? But incorporate these really simple tools in your day to day. If you really need somebody to do something, you have to make it as easy as possible. As easy as possible. I think about, when you get an iPhone, you don't also get a user manual. They just made it really easy to figure out. You can just kind of push a couple buttons and you figure out how to do everything you need to do. Where there are other phones that are much more complicated to use. I'm like, I don't know how to use this phone. I should know how to use this phone. It's a phone. Just make it easy for me. So when somebody comes to work, let's make it really easy for them to do their job. And if they have to stop and ask questions every step of the way, they're never going to be able to get all the work done that needs to be done in a day.
Right. So what would you say about when we're thinking about the financial burden of either setting these processes and the time that it takes? Do you think that kind of outweighs the benefit?
Oh, to have a person who's just, their job is to sit and think about how we do our work and make improvements. It's often thought of as a nice to have, but you need a medical assistant to be in the room with the doctor while they're doing a procedure. Of course, if you can only have one person, you have to have that. You have to funnel your dollars to the people that are doing that work. But it's your long-term investment, right? So why care about process improvement? Why care about operational excellence? It will absolutely save you time, energy, and prepare you for growth. Those are three verticals. The time bucket. Think about the time your staff spends trying to figure out what to do next, because it's not clearly documented. They don't have the checklist. They don't have clear direction. They spend so much time trying to figure it out. But then if they don't get it right, you spend so much time on the rework. The work still has to get done. Now somebody has to touch this thing a second time to fix what wasn't done right the first time. So you're saving time. Money, think about turnover. I'm frustrated. Every day I come to work, I get in trouble because I didn't do something right, but I don't know how to do it. Things change every day. I can't keep up. Nothing's documented. I can't work here. It's chaos. And one of what I like to do often is I will go to healthcare companies' pages on Glassdoor and read reviews. And you will be surprised how often you see things like nothing's documented, processes change every day, I have no idea how to do my job. And it leads to a 1-star review on Glassdoor. People leave companies because of that. So if you have that turnover, everybody knows the stats on how much it costs to recruit and retain employees. But think about what we talked about earlier, that institutional knowledge. Every time somebody leaves, they take information with them. And then you're left with a gap. Now we have to spend all this time to figure out what this person did because they left. And we're now not getting biologics approved because our coordinator left and nobody else knows how to do that job. So money, that's going to save you money. And then think about the energy. If I come into my job and I know exactly what to do, I'm not spending all of this additional energy and resources of reaching out to my manager all the time to ask a question. My manager's got other work to do, right? Don't solve the same problem twice. Don't answer the same question over and over again. Give them the ability to self-service. Give them the ability to go to a place and find the answer. So all of these things take time, and they can seem daunting to people who don't have a process mindset. Where for me, this is just the way my brain works. Let me dig in. Let me create your process. I'll do it quickly and your team will be set up. We'll never have to talk about medical records release again. We created a process. We hired a vendor. We outsourced. This problem is solved. Let's never talk about it again. Or in the biologics world, let's create that process. Let's hire BC educators to do this work for us. We solve the problem. Let's move on and use our resources and our energy to solve bigger problems. The next problem. How do we grow? How do we this? And then once you have your foundation in order, once your house is in order, sky's the limit. You can grow as fast as you want. One thing that I found with a company I worked with recently is they had this really huge marketing campaign about to launch to get patients in the door. They were not prepared. They were not prepared for that influx because they didn't have the systems in place. So those would be marketing dollars wasted. Because back to your story of the patient you interviewed, she went to multiple providers until she found the one that made her feel comfortable. So imagine you hear the ad or you see the Instagram ad about this great new place, you show up excited, and it's a disaster. There's a line out the door to check in, or your billing was wrong, or the provider was running behind. You're not going to go back because it wasn't a good experience for you. Mm-hmm. And as a company, they just wasted a lot of money on marketing dollars because they hadn't prepared with process before the influx of patients.
Right. Yeah. I think a lot of times you're just so ready to just get started, get the patients in the door, and we'll figure it out later.
Figure it out later, fly the plane or build the plane while you're flying it. Like, we do that all the time because you can't anticipate every problem. You create the process to solve a problem. You weren't proactive about it because you couldn't even imagine that thing was going to happen. So problems are actually a gift. Challenges, problems, issues, that's a gift because it's showing you where you need a process. It's showing you where something broke down because somebody didn't know what they needed to do. And you always blame the process, not the person, because everybody is here to do a good job. People want to leave work at the end of the day feeling like they accomplished something. So people aren't intentionally not entering insurance because they don't want to. They probably didn't know they needed to. So if you have a breakdown, think of it as a gift, and it's pointing you at where your problem is. So then dig into that, solve that problem, and then support that person. Let them know that it's not your fault that you didn't do this right. It's our fault because we didn't teach you how to do it, and we didn't give you the resources to go look it up.
So how would you measure the effectiveness of a newly implemented process?
Yeah, so this is another favorite topic of mine. So you can't fix what you don't measure. It depends on the problem. And it all started with that business leader saying, this number is not what we want it to be. So that number, you need to pull that through to a dashboard, visibility to the various people that are accountable for various pieces of the process so they understand what that should be. That very easy example of collecting email addresses for all patients. The manager needs a report from your electronic medical record of how many new patients were registered with the email field blank. Very simple. So then she can say 50% of our patients don't have an email on file. I'm going to go back to the front desk staff and I'm going to really re-educate them on this step. All the way up to, that's a very, very simple analogy, but this works with your revenue. Our revenue is not where we needed it to be. We need to make sure that the person who is accountable for the various processes understand the number that we want, understand the number where we are, and they know the action to take to go from A to B. So without visibility, without dashboards, without quick access to accurate data, you can't manage a process. Without hovering over your staff to making sure they're documenting, failed treatments for psoriasis prior to doing, a prior auth for biologics. So you have to be able to pull that information and display it in a way that's easy for people to understand. I live in Excel. I can read Excel like I can read a book. Some people, you show them an Excel spreadsheet, deer in headlights. They're not going to understand that information. So you have to be the translator. You get the Excel and you understand it, but how are you going to send that information to the person who has to act on it so they understand what to do?
Right. Yeah. And how would you keep that focus going, especially if it's, maybe it's new technology that they have to learn and they're not quite ready to embrace that new technology?
Yeah. That's hard. That's really hard. You have to bring that person along in the journey, helping them understand why it's important, but also you need to understand what are their barriers. Is it new technology and their mind doesn't work that way? Then in some cases, you're not going to overcome that. But in most cases, if you sit someone down and you understand where the barrier is and you unlock that for them, then they can move on. They can understand the new technology, or they can understand the why behind why they need to do the new thing.
Right. So, okay, my last question. What are some of the most transformative outcomes that you've seen from effective process changes, and how did that affect the company just overall?
That's a good question. Big transformations. Let's talk about EMR implementation. Changing an EMR is a huge undertaking. Mm-hmm. And a lot of people will stay with an EMR that they maybe don't love because it's way easier than changing an EMR. So I think a really transformative project I was lucky enough to be part of and run was changing an EMR for a large healthcare practice and doing it in a way that minimized disruption, that use this as an opportunity to fix broken processes. Because again, get your house in order before you add your technology. If you don't have good processes, adding an EMR on top of that is not going to solve your problem. So in this EMR implementation project, we were able to dissect every piece of the patient journey and make sure we rebuilt it in a way that the EMR supported. And I think it set us up for more efficiency in the office, more transparency for the management team, and then just a better system to help this company grow. We were sort of running out of room in our current EMR, and we had to move to a new one. We also pull out little glimmers of where people they were maybe resistant in the beginning, and then they learn like, oh, wow, this is easier. I'm not spending 2 hours at home closing notes because the process was so much easier in the moment. I was able to document in real time. I now have my evenings back. Or I'm not staying in the office for 3 hours at the end of the day to document. Or I can now pull reports because this system is gathering the information I needed to gather. I can manage more effectively because I have access to data that's really helpful. Mm-hmm. I think that was a really impactful project. Another really impactful project, this is a former guest that you had on, Kimberly Bailey with MIPS.
Yes.
MIPS is such a misunderstood system, and Kim is great at explaining it. But it can have such a huge negative impact if you don't get it right. And I've worked with companies to really focus on their MIPS strategy with the help of Kim and creating that workflow so they can do it easily, so they can document the tobacco measure right, and you can get credit because it translates to dollars. It translates to millions of dollars.
Yeah.
And if you don't get it right, it's millions of dollars in the other way.
Right. It's wild.
Yep.
So really kind of what you're saying is finding those experts and putting those experts in place to help you build your company.
Absolutely. It's so critical to have the processes in place so you can do what you need to do to grow your company, not solving the same problem over and over again, not, like really reducing that rework. Just get it right the first time so you can move on. You can think about bigger things. I think it's really critical. And some people are lucky enough to have that internal person who's able to do that. And if not, I think you go outside and you find that person. You may need that person for 3 months, for 6 months to help you get your house in order, and then run with it. Get ready to spend those marketing dollars. Let those people like flood through the front door, and don't stress it because you're in a place where you can handle it.
Right. That's so good. And that is how you attain operational excellence, right?
That's right.
I feel like that's a book. Did you write that? Are you writing a book yet?
I am not writing a book. I am not writing a book.
Well, thank you so much, Kelly. That was so impactful and such really good information. If anyone has any questions, where can they find you?
Yeah, so I'm on LinkedIn, just Kelly Poole on LinkedIn. Also, my website, theimprovementspace.com. This is where I talk about process improvement and how I'm able to help others. And my email address is kellypoole@theimprovementspace.
Okay. Well, thank you so much. It was such a pleasure talking to you, and I look forward to maybe talking again soon.
Yeah, you too, Janelle. Have a great day.
Thank you. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.